Wake up, fam. How are you? Hey, Adam. Hey, Abimbola. Hey, sister.
Hey, Dr. Alexea, how you doing this morning?
I'm good. How are you?
Every
Hi,
day's good.
everyone.
Every day's a good day whenever you wake up.
Amen. And it's good to wake up with the wake up crew. I'm excited to be here this morning with you all. This morning, we're going to be talking about how to find and establish a rapport with a great doctor and get the best care possible. It's a nice conversation to have after we were blessed in the community by Dr. Safo earlier this week. And it's just an important conversation to be having, especially right now when we're still in the pandemic. We're facing multiple viral infections. People's health is, really, I would say, sort of under attack just based on the circumstances and the many stressors that we've all been living under. And so I'm super excited to welcome everyone into the space here on Zoom as well as over in Facebook. And I'm looking forward to us having a valuable and engaging conversation.
Wake up, everybody. It's time to get up. Wake up, everybody. It's time to get up. Stay woke, stay woke, stay woke. It's time to get up. Stay woke, stay woke, stay woke. It's time to get up. We're healing, we're dealing, we're growing. Together, releasing. We're teaching, we're moving. Together, we're learning, discerning. We're striving. Together, we're leading, connecting, transforming. Together.
Good morning again. Hello, everybody. Hello, Wake Up Family, Woo Nation. It's your girl, Dr. Alexea, triple board certified infectious disease physician, mom, speaker, author, wellness coach, and stage 3 cancer survivor thriver. I create healing pathways so that others can experience total health and wellness, mind, body, and spirit. I'm so excited to be joining you all today. You guys can put on the first slide for me. We're going to talk about how we can find ourselves in the care of a great doctor and how we can get the most out of our medical care. Sometimes we don't always present with a fantastic doctor, but that does not mean that you can't get good care from someone who maybe doesn't have the best bedside manner or who maybe isn't your cup of tea. I often have to remind my patients that, when I'm referring them to another doctor, I'm like, listen, don't go in there expecting all this warm, fuzzy, probably not going to get a hug from your other providers. They're not going to remember your children's names, or maybe they do. But you may not have the same experience. It doesn't mean, though, that you got bad care or inadequate care. You got what you got. The point is to get the most out of the conversation or the interaction that you're having with a healthcare provider, and to have the best care, right? To get the outcome that you need for your health, your well-being, your own longevity, and really for your own peace of mind. When patients express dissatisfaction to me, what I often find is that the issue isn't always that they didn't get the care that they needed. Sometimes they just didn't get their questions answered. They didn't get the counseling that they needed. They didn't get their fears and worries allayed. And there's definitely a way to negotiate that in the small time that our insurance companies allot us with our providers. So let's jump into that conversation. Okay. Next slide, please. And today's slides will be mostly pictures. This is kind of, um, how did I get to this point other than, oh, just being a doctor, so I can speak to how do you get the most out of the doctor's visit? I'm also a patient. I'm living with chronic medical conditions, and I started wearing patient shoes very early on. I graduated undergrad with having found a lump in my left breast on a self breast exam. Ladies in the space, I hope that you are doing those and know how to do them. And so when I moved from Tennessee to South Carolina in the interim, back to South Carolina in the interim between medical school, I was navigating healthcare as a young uninsured Black woman. And so I found this lump and I was very fearful about what it might mean for my health and well-being. At the time, I was caring for my grandfather along with my family who was actively dying from metastatic prostate cancer. And the reason I actually started doing self-breast exams at the age of 20 was that I had met a young Black woman who'd been diagnosed with metastatic breast cancer after her fears and concerns about a lump she found had been ignored for years. She'd been repeatedly dismissed. So I'm entering into med school with something going on in my body that I don't know what it is. I had the absolute worst fears that I was conjuring up in my mind, and I was having to go to community health clinics to, try to plead my case. And I was just being told, well, you're too young. It's not cancer. Go on with your life. I don't know what it is, but it's not cancer. And I'm like, well, how do you know that? You didn't do any tests. You don't have x-ray vision. And I have these two stories playing in my mind about, what is the absolute worst case thing that this could be. And as doctors, that's really the first thing that we rule out when someone presents with acute or chronic symptoms. What's the absolute worst thing this could be? What is the life-threatening thing that this could be? And so I went for a couple of months being dismissed. I eventually moved from South Carolina back to New York, and I was sent to the Kings County Hospital surgical clinic. And I don't know if anybody has ever been in that space, but you don't get an appointment. You arrive there as early as you can if you are smart, and you pull a little sticker, like the little paper ticket, like you would at the butcher shop or the DMV, and you just wait your turn. And everybody's in this clinic. It is children who've had surgeries, and it could be any kind of surgery. Maybe they had their appendix out. Maybe they were a young adult male who had a circumcision last week. It was the trauma patients, the people who had been assaulted, had stab wounds, had gunshots, had, come out of the hospital from a trauma admission. It was people like me who had no idea what was going on in their body, but someone directed them to the possible care of a surgeon. And so this clinic is run by the residents, right? The trainees, and there's multiple residents, but they're being supervised by one or two attending physicians, right? The senior faculty who's completed their training and is supervising and educating these residents. So I wait in line all day. I made a friend because I was there for 8 or 9 hours before I was seen. I was examined by a young white male doctor, and he examined my breasts without the supervision of a chaperone, like a female chaperone should have been present. And I didn't know what I didn't know. So, and I just wanted answers. So I let him examine me. And then he's like, well, he could barely find the lump. I had to show him where it was. And he's like, okay, well, I don't know what it is. I'm gonna go get my attending. The attending comes back and he's like, do you mind if I examine your breast? I'm like, listen, sir, at this point, so many people have touched my breast and my body and not giving me answers. If you don't have an answer, like if you can't tell me exactly what this is, then I would prefer for you to not touch my body, you know? So he's like, well, I don't know what it is. It's probably benign. It's probably not cancer because you're too young and nobody's too young to have cancer. Um, and so I was just sent on my way after waiting all day for these providers to see me. You know, they offered me nothing more than I walked through the door with. They didn't really give me a thoughtful evaluation. And they literally sent me out with nothing, no imaging or anything. Now, if I had been prepared to advocate for myself, I could have, although I should not have had to, I could have possibly steered that visit in the direction that it needed to go. So we're going to talk about how that could have gone. And then, you know, I'll tell you now how the situation ultimately ended. So it was my mother who advocated for me, right? I'm starting med school. And she's like, let me just call the people at the med school. She called the dean's office and she let everybody have it. How can you let your student who's going to be a future doctor go to this clinic, sit all day and not have answers? How can you leave your student worried and having to deal with the stress and anxiety of not having adequate care and not knowing what's going on in her body? And so that day, they were looking for me. I was in our study carrels. I didn't have a cell phone at the time. So they were looking for me, running all over the school, looking for me because they had gotten me an appointment with the chief of surgery. The chief of surgery at the time was a Latina woman. And so when I ultimately saw her the next week, she saw me with a resident physician. And let me tell you, if you're being seen at a teaching hospital or a center where they have trainees, that's not a bad thing. That's actually a good thing because residents, med students, they're eager to learn. They want to be helpful. They want to get good grades. They will look up and research things that the attending physician doesn't have time to look up. They're in the business of impressing their preceptors. And so they go the extra mile most often for the patients and for their attending physicians. So for some people, especially if they're really medically complex, seeking care in a teaching environment can definitely have some pluses. It can have some minuses, but we'll get into that as the conversation goes on. So I saw the resident physician. She and the attending physician ultimately examined me together. So it was a chaperoned exam, as it should be. If someone's doing something more than listening to your heart, your lungs, and examining your belly. And they gave me what's called a differential diagnosis. So your differential diagnosis is the list of things that it could possibly be. And usually at the top of that list is what's the most likely thing. And a close second would be what's the thing that could cause my patient significant harm, morbidity, mortality if it is not addressed properly. And then there's the things that it's less likely to be, but still are worthy of consideration, right? So they said, well, it's probably not cancer. And they told me why they thought that. So she gave me descriptors of the mass on my exam. She specifically told me, you know, it's very smooth. It's not matted or fixed to your skin. It's mobile. You know, based on your symptoms, your age, your exam findings, this is probably a fibroadenoma, which is totally benign or not cancer, but we'll get an ultrasound to confirm that, right? So anytime a provider is trying to figure something out, if they don't offer up freely what they think it is or isn't, ask them, say, what is your differential diagnosis? What are you thinking this could possibly be? And if they don't freely give you, we're going to figure that out by way of labs, imaging, referral to another provider. Then ask them, hold them accountable. what labs or imaging are you planning to do to figure out what's happening in my body? Or does this workup require additional subspecialty care? Should you be making a referral to another provider or a subspecialist who can either aid in a diagnosis or more definitively address this problem or give us a working plan? Ask those questions and ask them in a pointed fashion. That can really help your visit along. So I'm going to just check the chat. I definitely want this to be a conversation. So I would certainly invite someone from the community to chime in and share an experience where they may have had what felt like an unsuccessful visit, or a visit where they went to the doctor and they felt like they didn't get anything out of it. We live in a very survey-based, evaluate, Yelp, Google, all the things ways in which you can either praise somebody or tear them down. And so one of the things that wrecks my soul is when someone leaves my visit and says, the doctor didn't do anything for me. Because that means your patient came in and left with the exact same question and concerns that they had. And I personally know that feeling. I entered into med school having had that feeling after having terrible care repeatedly before starting med school. And so that experience made me the type of doctor that I am. And so, in having this conversation and holding space for this conversation, I get to speak about it from both the provider and the patient perspective. I've been in the patient's shoes. I've been in you all's shoes. I've been scared. I've been absolutely fearful of the unknown. I've, absolutely had the experience of, is this thing going to kill or harm me? And so I get that. So Cheryl tells me there's a hand raised. I can't see whose hand's raised.
Yes, I've got you, Dr. Alexea. I've got you. We have a couple hands raised, and the first person I'm going to invite into the space, into the room to share is Abimbola Wally. Could you please come off mute and share with us?
Peace and blessings, Dr. Alexea. It's always good to see you in Woo space.
Morning.
So what happens? I've had my experience is a little different. I belong to Emory. Emory has the network, and my problem is every time I would get a good doctor, because I love female doctors, and then I'm with them a year, and then they leave. And it's been 3 different doctors, and they left.
Yeah.
And it's so disappointing because they know my history. I have an excellent relationship with them, and then they're gone.
Yeah.
And then I switched from Emory, and then I went to this new center, Centerwell Primary for Senior Care. Excellent doctor, Dr. Brown. Went there. She said, I'm leaving. I am just so distraught.
Yeah. Yeah.
Because,
yeah. Yeah. So at Emory, you were likely in a resident clinic, like I referred to, where you were probably working with trainees. And so every 1, 2, or 3 years, depending on which training or educational path they're on, it turns over. So that can be very challenging, especially if they're not staying local. So I've had patients that have been in my care since I was a resident or a fellow because I stayed within the same health system. And so they just followed me over, or years later, they're like, oh, she's out here. I remember her. And they'll come find me. So that's one of the downsides of being taken care of in a resident clinic. Yes, you do meet wonderful, young, eager doctors who don't have very many patients on their panel. So they know everything about you. They know every detail. They have time, right? Their income is not based on volume. They are paid learners in a system. And so they can spend a lot of time with you at a visit. And then typically there's an attending or supervising physician in the background who's usually staying in the system for years, sometimes decades. You know, the folks who trained me 10 and 15 years ago are still working in our system and training resident physicians, as well as have their own private panels. So, you know, you have longevity there, but that's not the person you connect with. That's the person who just, you know, maybe comes in at the end of the visit, or you may not even see them sometimes. They just make sure that the resident is doing everything that they need to do and doesn't miss something. But yeah, you lose that point of connection. So that's hard. And then the other thing that's happening now has always been a thing in the medical community, but is worsening since the pandemic, is physician burnout. And so providers get very, I don't want to say overwhelmed. That implies helplessness. We're not helpless. We're just exhausted of a system that puts so much stress and strain on providers with little thanks, with inadequate pay. And so providers will leave and move on to the next thing, or move on to care that better honors their quality of life and well-being. And I will definitely say that early in my career, I was trading my health and well-being for someone else's and in exchange for healthcare dollars. And what ultimately happened to me is I burned out, I got sick, and you know, I was making fantastic money, sometimes more money than I had actually time to spend, but it cost me something, and I can't buy back my previous state of being or my previous health. And so you know, for me as a provider, yeah, I want to do the absolute best that I can for my patients, but I have to make sure that I'm also putting up appropriate boundaries, and that I'm doing what I can to take the best care of my patients, and that I'm doing so in a way that doesn't put me in a state of overwhelm, doesn't put me in a position where I'm giving inadequate or subpar care, or care that is dissatisfactory to my patients. Because if people, you know, feel unseen, unheard, don't feel validated, um, then they will,
Mhm.
then they'll either leave, or the doctor provider relationship becomes taxed. There's a loss of trust, and it actually can make navigating through patient encounters a lot more challenging than it needs to be. So even though we have time constraints, if we manage the appointments appropriately, and I mean manage from both the provider aspect and the patient aspect, then we can still have a successful visit, even with sometimes limited time. But then also, if a patient has a complex issue, when they're calling for an appointment, they should stress that. And they should say, I want to know if it's possible that I could have a longer slot, because this is a chronic issue. No one's been able to figure it out. There's a lot of labs to go over, or a lot of imaging to go over. And I would like to know if I can be booked for a longer spot. And typically in my practice, the way that I negotiate that is I'll either make someone maybe the first patient of the day and come in earlier to see them, or I will make them the very last patient of the day. That way I don't have to rush, because you don't want to rush through an encounter like that. Obviously, it's not a perfect world, and we don't always get to take advantage of that kind of opportunity, but it's something we should definitely ask for, and we should prepare our providers and their staff ahead of our visit that, hey, this might take a long time. Is there a way that we can accommodate for that? You know, maybe you would be booked as the last patient moving into a lunch break, and that might offer the doctor an opportunity to spend a little more time with you. So thank you so much for sharing that, because that's an important point. And I know that that's not an experience that is unique to you. That's an experience that many people have, especially if someone is more medically complex or is seeking care in a larger health system. The turnover of doctors can be high. But if you feel like you're still being cared for, even though you meet a new doctor every 1 or 2 years, it's still a good idea to stick within the system if everything else is meeting your needs, right? In a system like Emory, your records are going to be there, your labs, your imaging, consults from other doctors, everything is central. And so they have that to refer to. So that's important. And then who was the next person? Oh, who's speaking? I'm sorry.
No, I just said thank you.
Oh, thank you so much for sharing with us. I appreciate that. And then John Carl, there was another hand raised. I think I saw 2 hands raised at that time.
Yes. I'd like to invite Elaine Bay to share.
Good morning. I'm driving, so I don't think I can do the video, but thank you for letting me have some time to share. I'm actually very relieved to be here and to know that this is the topic for the day, because this is something that I have had struggled with recently, and my frustration has sort of grown more recently with the healthcare, I guess, system. I tend to try to go the homeopathic natural route as much as possible, but having kids, of course, I do trust in the education and knowledge of medical professionals. So I sort of tend to use an approach where I can do it as holistic, as natural as possible in a preventative way. But then there are also situations where I know I need, a doctor. So when it comes to children, recently with them going back to school, my daughter has been sick quite a lot, and it's more than usual. So of course, this is going to be concerning to me.
Yeah.
I would normally take care of it naturally at home, and then, if her symptoms are any longer than 3 days, I'll go see a doctor. So there's things that I know that, I don't need to go. It's not an emergency. And I think about that before I come to the doctor, because I know there are a lot of other patients that have more serious and probably more urgent concerns. But my frustration is when I do take my child to the doctor, our insurance, our healthcare provider under our insurance is a doctor that is also, it's a primary care and an urgent care location. So the problem with that is if I go for myself, there's been lots of times that I've gone where it's been feeling very rushed, because this is my primary care doctor, but they're also working in an urgent care setting. So I don't feel that kind of ability to establish a good long-term care, because every time I go there, I feel as if it's just a one-time appointment and it's very, very rushed. I've even had more recently a doctor see me personally, and the entire appointment when he came in to when he left was maybe 3 minutes, and he just looked at me and then diagnosed me, and then didn't really answer questions and made assumptions. And I was trying to have a dialogue with him, but it seemed as if he was already out the door. And I've had that with like my gynecologist. I've had that with multiple doctors where I can feel that they are trying to see me, but it's like they're not really there, and they're not really seeing me as a patient, and they sort of group me in with everyone else who has the same symptoms. And I know my body, and I'm trying to alert them, like, this is something that is not usual for me, or this is something that is different from what other people are having. Can you just look into it? Not trying to step over what they know, but just trying to, bring my attention. So I've done that with my daughter too, where she's been sick almost every 2 weeks with a recurring fever. And, they told me that there's lots of different viruses that can cause it. And I'm more at ease now, but it's frustrating when you go and you get no answers, and there isn't sort of like, I go to the doctors to sort of get some reassurance, or to be put at ease, or even if you give me some information, like knowledge, then I can take that with me, because I don't want to go on the internet and find my answers, because that's just going to make me even more paranoid.
Yes.
So I want to go to the doctor and say, this is what's happening. Is this normal? And most of the time I have lots of questions that are, honest concerns. And I try to be as open as possible so that they know, what's going on and what could be the possible issues. But a lot of the times I've just been feeling like we've been leaving just sort of not reassured, very like feeling like almost misdiagnosed, which has happened to my daughter before. She's been sick, and we left and came back, and I was like, this is not normal. I know you guys told me there's nothing wrong with her, but I see that there's something wrong. And she had pneumonia. And so it's just that where, I don't want to not trust the doctor, but it's like, I almost don't want to go anymore, because I don't feel any more comforted than when I came in.
Yeah. And that's a terrible feeling. And I always say that to my patients. I'm like, I don't want you to leave with the same fears you walked in with. I don't want you to leave with the same questions you walked in with, right? Sometimes we can make a perfect diagnose, right? We can do in-office testing. Okay, your child has strep. You need 10 days of antibiotics. This is what to come back for. And everybody feels good because it's an answer, it's a definitive treatment. There's a finite end to the condition, and you know exactly what to come back for. But everything isn't always that simple or straightforward. Definitely, there are time constraints in medicine, but doctors can take more time. You just have to find a doctor who is willing. The urgent care / primary care model is a beautiful thing if there's one person on the urgent care side and other people doing the actual primary care and the well visits, so that those things aren't like coming together and derailing other visits. But I hate to say this and out my colleagues, but the urgent care model is treat them and treat them, right? Get them the answers, send them on their way. They're not well, it's not a well visit. So it's not a whole head to toe detailed exam and asking about, your routine health screening, vaccines, colonoscopies, did your children get their lead levels and their iron levels or whatever the case may be. It is, what is this pointed problem? How can we best diagnose and address it? And here's the things that you can come back for, or that you should come back for. And you can negotiate that all, or the provider can negotiate that all in probably an 8 or 10 minute visit and be really complete. But there's no way to be complete in 3 minutes, right? The doctor is missing the point that for them, it's their 10,000th time seeing this thing, but it's the first time your child has pneumonia. And even if they are going to cruise through and just do fine and they just need the right antibiotics, and in a healthy child, you'll anticipate that they'll get better, they still need to reassure you by telling you, okay, here's this antibiotic, your child's not allergic to it that we're aware of. Here's signs or symptoms of allergies or bad reactions to the antibiotics. We can use probiotics to help with antibiotic associated diarrhea, etc. Right? Reassuring. You can anticipate that your child's symptoms will begin to improve after 3 full days of antibiotic therapy, and fever should start to go down by that time. You should come back for worsening breathing or respiratory symptoms, right? If your child is working hard to breathe, if the fever is not breaking or going higher, if they look ill, they can't eat, drink, etc. And those things can be given to you in counseling by the provider. If the doctor seems in a rush, you can ask them, is there a nurse or is there another provider here? Maybe they have a physician assistant, a nurse practitioner. Maybe they have a medical assistant who's always in the room and knows the exact counseling that they would give, right? You say, you seem to be in a rush. Is there somebody else in the office who can answer my questions? That could be helpful too, because it's the worst feeling when you're still talking, you still have questions, and the doctor gets up and they have their hand on the doorknob, and you're like, am I allowed to ask? Do I just get on out the way? Like, what's happening here? But the reality is that your child, your provider, they can bill based on the number of minutes that they've spent with you, counseling you, and so they can take the time, right? But you have to ask. The other way to negotiate that is when the medical assistant or the nurse or whomever is doing the initial intake, you can say to them, I want to ask the doctor these questions, and you can give it to them in writing, or you can express the questions, and that way the doctor is coming into the room knowing that you have these questions, and they're prepared to spend that time. Because people are like, all right, this is an easy visit. It's, it's strep, it's flu, it's COVID. They assume that everybody is on the same wavelength with how to manage and deal with it. And when they assume that everybody has the same fund of knowledge about these situations, and so they may not provide the counseling because they're like, oh, it's flu, it's COVID, people know how to deal with that, or I gave 5 days of antibiotics, that's all they need to know. And that is not true. Even if that works for 7 or 8 out of 10 patients, if you're that in that 2 or 3 who it doesn't work for, then that person owes you the time or explanation, or somebody else in the office to provide the counseling, or they can give it to you in writing. In our, pretty much 99% of healthcare facilities are on an electronic medical record system, and built into those systems are educational sheets that are related to the diagnosis. So you can also ask them, like, is there a handout? Is there some reading material? Is there a link or a website you would recommend that I go to further educate myself? Because, as much as we are there as providers for the patient, and you are our focus and attention in the room, how many rooms are filled with people waiting? And so people often struggle to negotiate that time, or they struggle to make people feel seen and heard, right? They could spend the same 3 or 4 minutes with you and just sit down, make eye contact, and have a pointed dialogue, and it would feel so much different, even with the same time, than if they stood there holding on to the doorknob the whole time. So you got to find a provider who will show up for you in that way. And with some of our insurances, they will assign you a provider, but you have the right to change that provider. So don't feel like you're locked into that doctor, that location, because that's who your insurance company put on the card. If there's another provider that is on their panel, and you can switch to, by all means switch. I don't believe that there's any limit on how many times you can switch doctors. So, you can sort of go and interview another doctor and see if they're a better fit for you. So
Thank you so much.
Yeah, my absolute pleasure. Thank you so much for sharing. Thank you. That really lends to our conversation this morning. Let's see. Any, I'll just ask you, right? Do you see yourself maybe navigating your visits a little differently next time around? Or do you see yourselves, planning to make any changes based on that exchange that we just had?
Yeah, I have had that experience where there were doctors who were very present with me, even though the appointment wasn't very long. So I guess I do have to sort of continue to do the searching and the kind of trial and error to find the right doctor, because there have been times where I've seen a doctor very quickly and I wasn't satisfied. And then there were other times where I waited in the office for 3 hours and saw a doctor, and it was worth it, because he took the time to.
Yeah.
So I think it is just a matter of me finding that right person. It can be a little challenging when you have already gone so many times, but it is worth it to try and navigate that system, because I do find out that it does depend on the provider and the care, and also, yeah, the questions, being a little more vocal about what I need before I leave, because I do tend to sort of just make my way out the door when I feel as though they're being rushed, as if I'm, inconveniencing the doctor sometimes. So I can be more vocal about making sure I get what I need before I leave if I'm feeling that way.
Yeah.
But yes, thank you.
Yeah, your time is very valuable. So you don't want to, take time from work, travel to the doctor, sit in the waiting room, and then leave and not get anything back in exchange for all of the time that you've put out. That's something that I feel awful about when that does happen, when someone feels like, oh man, I took a half day off from work, and I didn't even feel like I got what I needed in exchange for all of that time and sacrifice on my end, right? I recognize, and I think most physicians are very cognizant of, on the patient end, there's so much more time spent to get to us. And, they have this very finite window, 15-minute slots, 10-minute slots, are you being double booked? And, your slot may be even shorter than that. But just because someone spent 45 minutes with you doesn't mean you got good care. You might get everything out of a 10-minute encounter that you got out of a 45-minute encounter. So it's not solely the time, face-to-face time that you've spent with the doctor, because a lot of times we're preparing for your visit beforehand. We're spending time thinking about and doing things related to your care, even after the fact. But the face-to-face time can sometimes feel or be very limited, but it doesn't always amount to or equate to inadequate care. So have pointed questions and make sure to get those questions asked and answered, and take it from there. So
Thank you very much.
No problem. My absolute pleasure. And thank you again for sharing. So let's go back to the slides for a little bit. The slides are really just reminders for me to cover everything that there is to cover and say everything that needs to be said over the course of this conversation. So I'm kind of using them as a guide and kind of a storyboard for this conversation. So, if you're in the space of having to find a doctor, right? And we'll get to the raised hands in a little bit. If you're in the space of having to find a doctor, right? It could feel like picking a name out of a hat when you're on your insurance page and they're showing you all the doctors in your area who are on your panel, right? How do you pick if they didn't just pick one for you? Ask a friend, right? If you're in a position where your doctor is leaving a system and you need another provider, ask your doctor. They'll know who practices similarly to them and who would be a good fit for you as a patient if they know you well. Ask other providers you might be in the care of, right? If you need a primary doctor, ask your OBGYN. Sometimes, you know, you find your way into a medical center or community because of an accident, an injury, a surgery, or something like that, right? And the folks who took care of you in an emergent fashion, or, you know, gave you very specialized care, they want you to continue to be well and maintain your health. So they will often make referrals to a primary care doctor or suggest that you see a primary care doctor. And so they can name somebody for you oftentimes. So they'll ask, you know, and put that in your list of questions that you ask when you're getting prepped for the visit, right? I'm concerned about these headaches I'm having. I'd like to have labs, and I need to know who's a good primary or a good neurologist who can help me continue my care. When I say interview your potential doctor, so patients call the office and they're like, I want to set up an interview with the doctor. And I'm like, well, it's an interview, but it's not like a job interview, right? So you have to schedule a visit that will be paid or billed through your insurance, because my time is valuable, right? I have expert care that I need to provide to patients. And I can't just be chit-chatting it up with someone who wants to pick my brain. So when you're interviewing a doctor, you're scheduling an appointment, and that appointment is to establish care. You can come in and discuss what are your goals for care. You could discuss what's your past medical history, your past surgical history, what kinds of things run in your family. And if I choose to stay in your care or in your practice, what does that look like? And what can we get done today in order to, start my healthcare journey or to support my healthcare and, my overall well-being, right? That's super important to do for your primary care provider. That's super important to do for your child's pediatrician. But if you think you're going to just call and like chop it up on the phone, or just walk in and stand in the hallway and just have a conversation, that's not how that works, unless it's something like a concierge practice where it's a paid membership to join the practice. But definitely you can interview a provider as part of a visit. And it's an important thing to do, especially for your primary health care or your obstetrics care, like your pregnancy care, or for your child's future pediatrician. You want to make sure that you and the provider are on the same page or on a similar wavelength, at least, because otherwise there may be dissatisfaction, and it may strain the patient provider relationship. And if there's not a healthy rapport or a good patient provider relationship, then a lot of times you can't really have a good therapeutic relationship. And that's something I often have to say to people, like, I don't think we have a good therapeutic relationship. And so, I think we need to transition your care to somebody else, or that we need to, think about if we can improve this interaction, or if we need to part ways. It's okay to part ways with a doctor. It's okay to fire your doctor. We don't take offense to that. I don't want to be in a patient provider relationship with someone who I will not have a good rapport or a good therapeutic relationship with. It's a very hard thing to do in the primary care setting. So it's okay if you have to move on. So 7:55 is upon us, and we definitely want to acknowledge the members of the community who have to transition out of the space. So for those who are parting ways with us, I want to make sure that I share my special offer with the community. And so I invite you all to check out my website, which is www.dralexea.com. You can check out my supplements line, which is www.dralexea.com. supplements. And then my contact information is in the chat. I'm pretty easy. You could find me at Dr. Alexea on most social media platforms. I'm most active on Instagram, Facebook. So you can message me there. I definitely invite you to follow me along there for what I call my medical motivation. I'm always sharing about all things pandemic, general health and wellness, and then of course, as a breast cancer advocate, speaking towards the cancer experience for those that applies to. So that is that. Did I leave out anything, John Carl or Cheryl, that I need to mention before we continue this conversation?
No, you're good right now. I do want to mention that we do have comments in the chat.
Okay.
And we
Let's see.
have 2 other hands raised.
Okay. All right. May I request that you read the comments and then we'll hear from the community?
Okay, comments first. Okay, let's go to the chat. Comment in the chat came from Cheryl. She says, I've had the same doctor for nearly 32 years. He's okay. He listens to my questions and will give answers. He will usually do the exam that I ask as well. Sometimes he just seemed a bit less proactive. I still stick with him though, because he knows I am going to go the natural route as much as possible. So he may suggest, but will not push scripts of meds on me. This other comment came from Harlem Jiu-Jitsu from Facebook. And Harlem says, I had a great doctor. They retired because of their own health. I am now in a medical practice where I have no connection to my doctor. My old doctor did a combination of modern medicine and holistic medicine. Abimbola shared, when my doctor left the practice, they now have a PA on staff to see patients, and I want to see an MD. Am I wrong?
No, you're not wrong. So this comes up in my practice as well. I have a nurse practitioner who works with me part-time, and she does our physical examinations, like your annual exam where you need to go through with your provider or a provider all of your age appropriate health screenings, right? Sometimes we come in for a cold, we come in for a UTI, we come in because our knee hurts, and that's all we can focus on at that visit. You know, we may order labs and it's like, okay, since you're going to get blood work done, then, you know, do it fasting and get your cholesterol or get your blood sugar checked. Let's check your kidney and liver because we're prescribing meds, but that is not the same as having your annual physical exam. And it's your annual physical exam where we catch up or catch things that we may have missed, right? Did your family medical history change? Maybe your mother or sibling got diagnosed with an autoimmune disease or cancer or some other hereditary or possibly hereditary condition, and we need to change your screening, or we need to change some of your routine healthcare or add to it based on that. We don't get an opportunity to talk about those things or catch those things when you're coming in for sick visits, and you only get one annual exam, right? So it is so important to take advantage of that. So I have my nurse practitioner do those because there's things that I do that she cannot do, right? There's diagnoses that I'll come up and make because of my infectious disease training that she would not come up with. And so it's important for the practice as a whole for me to focus on those things and for her to do the things that are like very boom, 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 right? This is it. It never changes. And if she needs to, she'll pull me in on a visit to address some other things. So your doctor having a physician assistant or a nurse practitioner, what we call physician extenders, is not a bad thing. They're capable providers, and the doctor should be supervising the things that they're doing, even if you don't see them every single visit. But what I don't like is some of these models of care, right, where you sort of get duped into thinking you have a doctor, where you meet the doctor the first visit and you never see them again. So that shouldn't happen. And, and that's not to say that physician assistants or nurse practitioners cannot handle care, especially if they're very experienced in a particular specialty or field. But we, in my practice, do respect that some people only want to see their doctor, their MD, their DO, and we honor that as much as we can. But there's a flip side to that, right? Your doctor can only do so much in a day. We often will have physician extenders because we can only, we need help, right? And it's okay to need help. It's okay to have an extra set of eyes or an extra set of ears, right? Sometimes my patients can see my nurse practitioner tomorrow, but they can't get on my schedule for 3 weeks. But if it's something that does also need my attention, then what we'll do is we'll put the patient on my nurse practitioner's schedule. She'll start the visit, she'll take the history, she'll do the exam, she'll come up with a preliminary plan of care. We'll discuss it, and I wrap up the visit together and maybe do a focused physical exam. It allows me to take care of more patients in a given day. And most of the time, that is what providers are doing. So it does help our providers, our doctors, if we're willing to also see their physician extenders, their nurse practitioners, or physician assistants. But I think that there is absolute value to having an MD or DO as part of your care and as your listed primary provider. There's wonderful, wonderful nurse practitioners in the community who practice independently, but just because there are and they can does not mean that you should be denied the type of provider that you want to see. So thank you for bringing that up. All right. Any more hands raised, John Carl?
Yes, we have another hand raised, but I want to read this comment that came in from Jackie.
Sure.
Jackie says, all the doctors I have seen are long-term. I try to choose those who have a private practice. For the past 30 years, I have been with a group medical practice. I was seen by the physician who ran the practice until he retired. I like doctors who were not quick to prescribe meds. He discovered I had thalassemia, and I hope I said that word right.
Yeah.
When my previous doctor and OBGYN just said I had unusually small blood cells, was anemic, and prescribed iron supplements. Thankfully, I listened to my body and knew that the iron was not helping. Now that he has retired, I see another doctor in the practice that understands my needs and respect my reluctance to be on meds. All of my doctors get trained by me to deal with me. I ask a lot of questions. I look up information. I read scientific studies and any information pertaining to whatever my issues are. Sometimes they joke, oh, did you contact Dr. Google? I tell them, absolutely, LOL. Okay.
I love that. I love that. Yeah, you are the expert in your own body, right? You have a PhD in me, and nobody can override what you're feeling and what's your lived experience, right? It's up to your doctors to listen and be willing to work you up based on the symptoms that you're reporting, the changes in your body that you're reporting. And yeah, if we're rushing and if we're acting in haste, you can see somebody's complete blood count, one lab, one snapshot, one picture in time and think, oh, this person has anemia. They would benefit from some iron. But a person with thalassemia does not have an iron deficiency, even though they have really tiny red cells. And you can have too much of a good thing, right? Iron is fantastic if you're deficient and you need it. But if you don't, it can actually be toxic. It can be stored in places like your liver and your joints. And so we don't want that. So yeah, we want thoughtful providers. We want providers who, if we're in a multi-doctor practice, who document well so that they're communicating with the next doctor that comes along, or with the nurse practitioner or PA who might see us in a visit, right? They paint a picture of who you are in the opening line of their note, so that when somebody else comes along and reads it, they know what's going on. They have an idea of who you are, and you don't have to like start from scratch every time you see a new face in the office. So all of that is important, and it would be wonderful if we were all positioned to have the same doctor for 20, 30, 40 years. It makes a huge difference in your long-term health. The practice that I took over, the provider was there for 40 years. And the patients who are in their 70s, 80s, 90s, she even had a couple of people who lived into their hundreds. They were in such fantastic shape because they had 20, 30, 40 years of excellent care with her. And so when I look at the 70, 80, 90-year-old people that I now get to take care of, who cognitively are intact, who are in great physical shape, who have, functioning hearts and kidneys because they've been on the receiving end of great preventative care, versus someone's 70 or 80-year-old mom or dad who hasn't seen a doctor since they gave birth to their last child. They get dragged in after a stroke or a heart attack or some other catastrophic event. They are in much less health compared to the people who have had ongoing, continuous, good primary care. So it behooves us to have good primary care so we can catch and address things, so that we can appropriately manage chronic medical conditions or conditions that run in the family, so that we can screen regularly for things like cancer that you want to get ahead of, rather than get diagnosed by the time you're symptomatic. Because if you're symptomatic from a cancer diagnosis, already advanced. So we don't have delays in diagnosis there. Let's see. So let's go back to the slides for a second.
Okay.
And then we can advance from the last one that we were on.
Okay, I'm gonna share first and then advance. There we go.
All right. So we talked about time, right? How limited time slots are in doctor's appointments. And, one thing you have to remember is your doctor has to spend a lot of money to be able to take care of you. And so in order to really get the most out of, not get the most, but make a living and make it worthwhile to practice medicine, your doctor has to, put a certain number of people in the schedule, right? And sometimes people get sick, emergencies happen, and no more minutes appear in the day just because another patient was added on. So it's important for us to communicate in a way that is really concise, but says everything that needs to be said. So the thing that I hate the most is when I ask people, what brings you in today? They're like, well, I think that I'm just going to use Lyme disease because it's something I see often. I think I have Lyme disease, and I belong to this group. And the person in my group said that their doctor did, and they want to list all these things. And I'm like, listen, it's wonderful that you educated yourself, that you have support around your diagnosis or the thing that you think that you have. But the only way for me to make a diagnosis is to know your symptoms. So when was the last time you felt like your usual self as it pertains to the thing you're coming in for today? And, what are you experiencing? And people will be like, well, I have Lyme. And I'm like, well, that's a diagnosis. That's not a symptom. It could be right. It could be wrong. But as a provider, I can only make a diagnosis based on symptoms. So before your visit, it's important to think about what compelled me to pick up the phone and call this doctor, and how can I best communicate that, right? So, I'll give you what in my mind would be like the perfect presentation, right? So somebody might come in and say, listen, doctor, I have a history of high blood pressure and diabetes. Those are very well controlled. I'm on these medicines, but 6 months ago, I began to feel unwell. I'm excessively tired. I can't make it through my workday. My joints ache. They feel really stiff or locked up in the morning, but as I get going, I feel a little better. I don't have any fevers associated with those symptoms. But what I do have is heart palpitations, and I never had that with my high blood pressure. Sometimes my feet and ankles swell, and I've taken, Tylenol and Motrin. But in spite of taking those medicines, the pain keeps coming back, and sometimes I get fevers or night sweats. That's like kind of the gist of what's your past medical history and what your current experience is, right? And then I, as the doctor, can come and ask more pointed questions to help me figure out what's going on. So, what is your primary concern? What is your chief complaint? How long has it been present? How do you describe it, right? If we're talking about pain, use descriptive language. Don't say it just hurts. And, 10 is the maximum on our pain scale. You don't have to tell me it's 15. If it's 10, it's 10. But if you're telling me it's 15, then that lets me know you're in a whole lot of pain. Tell me what makes it better. Tell me what makes it worse. Does it change with the time of day? What other things impact your symptoms? Is it worse if you eat certain foods? Is your breathing worse when you're in your office versus in your home? Is there any family medical history related to that? Or does a family member have similar symptoms and a particular diagnosis? Do you have any other medical history that might be related to that, right? Maybe you're coming in with joint pain, but you have celiac disease, right? Well, you could have joint pain as an extra intestinal or outside of the intestinal tract symptom of celiac disease. So it's helpful for me to know that, especially if I'm meeting you for the first time. So definitely, communicate clearly and concisely to help your provider figure out what's going on with you, and try to resist the urge to immediately start presenting what your friends, family, and neighbors said you might have. They could be wrong, they could be right, but see where the history and physical exam leads your doctor. Next slide, please. So, I'm stressing the importance of the history is because we make 75% of our diagnoses solely based on what you report. So again, report your symptoms clear and concise way. If you've already seen another doctor or you're transferring care, provide labs and workup that you already had before you arrive at the office, right? If you know you're coming in for this visit that you scheduled 3 weeks ago or 3 months ago, ask your other providers to fax labs over, fax imaging over. My patients do this thing where they want to hold on to their records. They don't want to hand them over to my staff. And then in our 20 or 30-minute visit, they want to present to me a 3-ring binder, a full ream of paper. Well, if you handed that over 3 weeks ago, I could have, after hours or before the office day started, gone through that, pulled out the information, began to prepare my note, and begin to have an idea about how I'm going to proceed with this information, because I was given the reason that you're coming in for the visit, and now I have some information to work with. So if you're a medically complex patient, and there's relevant labs or imaging for what you're coming in for, send that. Please do not send your doctor every lab you've ever had in your life because that's not helpful. And your provider's time is valuable and important, just like your time. So you don't want to needlessly suck it up, or you don't want to make the important information a needle in the haystack of information. Things that will turn your doctor off really quickly is like when you come in and say, I did my research. When you say I did my research, in our minds, we think that you're on the dark web, that you're in, some anti-vax community, and, you're listening to unusual things or things that may not be medically sound. So, look up medical guidelines that are related to your condition, right? If I'm going to my OBGYN, and I'm inquiring about, a pap smear, then I would say, I looked up ACOG guidelines, the American Academy of Obstetrics and Gynecology, right? I looked up the guidelines and they say that I'm supposed to have a pap smear every 3 years, but I would like to have one sooner than that because I had a new sexual partner, right? That lands so much better than I did my research. It is valid and it is important for you to research the things that you think are going on, but I will tell you where a doctor's mind goes when you say that. They assume that you've been somewhere that is not validated information or that does not direct our care, right? We do medicine based on guidelines and standard practices. And so, and how we deviate from that is based on your personal medical history, your symptoms, your family history, things like that. So, look up the guidelines. Again, write down your questions and see if your doctor answers them before you dive in. Because if you're listening, oftentimes your doctor will have answered your question, but a lot of times people are just waiting for you to be quiet and stop talking so they can answer. So make sure you're actively listening. So I've over the years of doing through repetition, gotten really good at predicting what questions people will ask. I'll always give common side effects of a medicine that I'm prescribing, and I'll always counsel a patient about what to come back for. And I will go through all of those things and say, do you have any questions? And the person will ask me the question that I just answered. So they are not actively listening. They're waiting for me to shut up so they can say what they want to say because they've had the experience of healthcare professionals not meeting their needs. So they just walk in expecting that I'm also not going to meet their needs or answer their questions. So make sure you're actively listening. See if your doctor answers your questions and gives you anticipatory guidance. And then if they've left anything out, then go ahead and ask. The important thing about that is it helps you build a rapport with your doctor. It helps you to recognize, hey, this doctor answered my questions without me having to ask. It helps build trust. It helps build the patient provider relationship, and it can help alleviate any anxiety you might have about whether or not your doctor is actually taking good care of you. So, make sure you're actively listening when you're at the visit. Hopefully they're providing all of those things, or giving you a good explanation of care. And if they're not, then yes, absolutely go ahead and answer the question. But I must happen 5 or 7 times a day where I'm absolutely answering the questions before I'm asked, but the person is not listening. So be an active listener, be an active participant in all aspects of your visit. Can help move the visit along more smoothly as well. Let me have you go back to the slide for me, John Carl. I just want to make sure I'm not leaving anything out that needs to be said. And then before we wrap up, you can go to the next slide. We will definitely hear from the community one more time. All right. So, people have mentioned already, those that have shared, right, that they're partnered with their doctor to get the best care that they can get, right? So, I have knowledge, I have expertise, I have experience as a provider, but you know your body the best. You are the MD, PhD of your body, and only you can communicate what you're physically experiencing. And then we can negotiate, are we going to go on a blood pressure medicine, or are we going to try to change our diet, exercise more regularly, drop a few pounds, and see if we can get the numbers under control. If the numbers aren't so bad that I think you're going to have a heart attack or stroke out, or that something is detrimental and we can't wait 3 months to see if lifestyle modification is going to change it, then great, right? Your MD or your DO is not a naturopathic doctor. They may not be aware or knowledgeable about some of the more natural medicines that you might be using. And just because something is natural doesn't mean it doesn't have complications or side effects. A lot of times people will come in and they'll present all of these very specific herbs and things that they're using to me. And I have to remind them, listen, that is outside of my expertise, right? That doesn't fall within the Infectious Disease Society of America guidelines for how to treat this infection. And I'm board certified and licensed to practice this way, to use these guidelines, to use these FDA approved drugs and treatments. And so I have to follow that. Am I knowledgeable about supplements? Absolutely, right? But sometimes people get very, very specific and very, very nuanced about things. And if I don't know, I'm going to tell you I don't know. And so, respect that, unless your doctor has told you they have this additional training and expertise, respect that these are the guidelines that they have to work within, or the parameters that they have to work within. You get to refuse care. That is your right and your choice. But oftentimes your doctors will insist that you hear the complications of not taking a treatment or an intervention and document it, and document that, you are quote unquote refusing or declining a standard therapy. And they have to do that to protect themselves. There's liability for the doctor. So, we typically operate with shared decision making, or with patients providing informed consent, right? If I come up with a diagnosis or a differential diagnosis, as I mentioned, I need to educate you about what are the potential outcomes, what's the worst case scenario, what's the best case scenario, what are the common standard treatments, what are the side effects of those things, and typically we only prescribe something if the benefits outweigh the risk or side effects of that thing. And those benefits may be short-term, they may be long-term, but that needs to be discussed so that you can make an informed decision. So, hopefully this conversation has been helpful. I see in the chat that someone inquired about red yeast rice supplements. Do they have the same effects as a statin? So in theory, yes, red yeast rice can bring down cholesterol levels and is thought to have less side effects than a statin. However, I get to measure that, right? I get to see for my patients who are like, oh, I'm taking red yeast rice and their cholesterol's still high, versus putting them on a statin medication and their cholesterol levels come down to an acceptable range for their past medical history, right? If you're someone who has diabetes, the diabetes all by itself is a risk factor for heart attack, stroke, and chronic kidney disease. So cholesterol levels being really low and bringing them really low by way of statins, if someone cannot do that by diet and lifestyle modification, is incredibly important to stave off the risk of heart attack or stroke. So let's go to those hands that are raised. If you all will allow me a few more minutes in this space with you, and then we'll wrap up our session.
Okay. Let's go to Sharon. Sharon, would you like to unmute and come into the space, please?
Okay. Hello, everybody.
Morning.
Thank you for being here. So I've been challenged with dealing with fibroids for for like the last 3 years, and I've gone to 2 or 3. Well, I've gone to 4 different doctors. One being a holistic practitioner, 2 of them are Western medication, and basically what I'm told is that they're non-cancerous. So I've been following them. They are non-cancerous, but based on what they propose is the quality of life. And I definitely understand what they mean, because the quality of life can be very challenged when I'm dealing with this. I was in full menopause for about 5 years, and then I started this untimely, like, bleeding. I'm thinking hemorrhaging, but what I'm finding out is what I'm looking at is not really like a bleeding. It's more like a breaking of tissue. And so I hope I'm not being too graphic, but that's what it is. And so I'm getting ready to see a new doctor, because, by all accounts, everyone is pointing to hysterectomy. And I've been trying, the eat, the packs, just everything I need to try. And I mean, it's a slow process. And that's where my frustration is, because no one seems to be able to tell me, like, how long would this normally last, or what it's going to be. And so it's like I'm jumping from doctor to doctor, and I'm not really jumping from doctor to doctor. I definitely respect and honor, and I understand when people can go no further with what they know. It's okay. Well, then let me try something else. But over the years, at first I heard 5, and then it went down to 3. The circumference has been depleting, very little, but it is depleting. Yeah. So, like, I'm just like, where can I find this gem of a doctor? I'm hoping that the female doctor, I'm in Maryland, I'm seeking out someone in Virginia who was highly recommended as avoiding surgery, which is what I'm opting to do at this point, because there is no danger of cancer at this time.
So let me, in the interest of time, so that I give you an explanation, and just medically, legally speaking, right? I'm not your doctor. I am a doctor, but not your doctor.
Right.
What I would say, based on what I am hearing, and what I will tell you based on what I absolutely know, postmenopausal bleeding is absolutely abnormal, even if you have fibroids. 5 years later, if you're no longer producing estrogen to feed these fibroids, yes, they can shrink. They can, what we call necrose, right? Some of the tissue will die off, but postmenopausal bleeding is never normal. So no doctor is going to normalize the fact that 5 years after going through menopause, you are having bleeding. So you need, at the very minimum, a biopsy, and you should probably strongly consider a surgery. And I think that nobody is giving you the answer that you want, because it's not the right answer. I know for Black women with fibroids, for too many years, people were snatching out women's uteruses, including women of childbearing age, including women who may not have had the experience or opportunity for pregnancy. And so I know we're very hesitant in that we don't want to be overly aggressively managed. But if you were my patient and you came into my office 5 years after menopause with bleeding, I would absolutely send you to a GYN and would tell you to anticipate being told that you would likely benefit from a hysterectomy, and that you probably would need a biopsy. And sometimes we can, do the shared decision-making thing, right? And sometimes we can meet you in the middle and tell you, okay, we'll come back if this or that. And sometimes we can't do expected management. Sometimes we cannot watch and wait because it's not the right thing to do and we can't get the time back. So I hope that, you are hearing
I am
that,
following up. Yes,
and
I am
that,
following up with a new GYN, and
yeah.
I respect, and I just heard something that you said that has not been said, that or maybe it's been said and I have not heard it. So I'm going to be honest, because like I said, I truly try to actively listen. I work in the field of human service, so I understand our listening skills are definitely important, because I need to listen to what's not being said as well as what's being said. I'm trained to do that. But when it's yourself, so I'm not sure if I've ever heard that about the bleeding being like something to take serious after 5 years. So that's something that I will be sharing with, this doctor that I'm getting ready to see. And so thank you.
Thank you for your share, and best of luck. Okay.
Thank you.
All right. We appreciate you. All right. Next, who's the next person? And then we'll wrap it up.
Yeah, Teresa is next. Teresa, could you please come off mute?
Hello, my love. How are you
Hi.
doing?
Good. How
I
you
haven't
doing?
seen you in a long time. I'm good, thank you. One of the things that I wanted to say to the young lady that had a problem with the doctors, that I report doctors. I'm a disability advocate, so I'm going to report you. And if I'm being treated, at a doctor hospital, a lot, and I'm getting that problem, I will report the office, because I feel like by me being a disability advocate, but also working with Shawnee doing the PAW things, is that the reason why we're not getting the care is because no one is like saying, hey, I'm not being treated carefully. The thing what I want to ask you is that a lot of times with me is that what I have a problem, like I like my the PA better than actually like my doctor. 'Cause I feel like my doctor is just rushing me in, and I don't like that. But the thing what I don't like is that because I've having other, like they say, well, doctors say about dealing with diabetes, so they want to recommend me cholesterol medicine, and my cholesterol is fine, and they're saying that my medical company recommend that. And I did have a bad problem with the thing, but why do they do that? I don't understand. It's like they're saying it's preventive, but if my cholesterol is high, why would you want to put me on a cholesterol medicine? And
So,
that thing I don't understand.
So there's standardized goals for what your cholesterol should be as a diabetic patient. The same way the goal in a diabetic patient is to keep their sugar under 130 when they wake up in the morning, and to keep their hemoglobin A1C, that long-term measure of your blood sugar, at 7 or less, right? While avoiding the complications of low blood sugars. The other thing with diabetes management is diabetes is a risk factor for heart attack, it's a risk factor for stroke, it's a risk factor for chronic kidney disease, and it's the number one reason people end up on dialysis in this country. So your cholesterol may be quote unquote normal, but because you're diabetic, it needs to be super normal. So the goal LDL cholesterol, the bad cholesterol for someone with diabetes is 70, because a diabetic will have a heart attack or stroke out on you if you leave their cholesterol at like 100 or 130, which may be fine for someone who doesn't have high blood pressure or diabetes or a strong family history of heart attack or stroke. So the numbers have to be much tighter, because we fully understand the risk. And in our preventative practice, we want to prevent the absolute worst case scenario. I'd rather have to maybe shuffle you through a couple of statins, because they maybe make your muscles ache or your joints hurt or your liver enzymes high, than to just say, well, Cheryl, I know you don't want to be on a statin, so don't be on one, right? if you have a heart attack, are you going to end up paralyzed on one side of your body? Are you going to end up with loss of the ability to speak or communicate or swallow? You know, are you going to have a heart attack and end up with massive heart failure? Are the arteries that supply your kidneys going to get clogged up and contribute to chronic kidney disease? These are the things I'm trying to prevent, or that we're trying to prevent as providers. And this is based on decades of data, following tens of thousands of people for years and years and years and seeing what happens. So we do that to prevent heart attacks or strokes. And the goal is to get your LDL cholesterol or your bad cholesterol less 70 or less, and to get your triglycerides, right, that other bad circulating fat, 135 or less when you have diabetic. So
I believe mine was low. Mine wasn't high at all. He just said that the medical health insurance recommended I do it. It wasn't that he wanted to do it, but so that's what I understand.
It's
That's
the
why
standard of care. He's offering you the standard of care, and those are the reasons why. And if he hasn't expressly said, because you could have a heart attack or stroke or chronic kidney disease, I'm saying it to you.
It wasn't him. He said my insurance said they wanted me to put on this medicine. It
yeah,
wasn't
they
him.
want you
He didn't
on
suggest
this.
it.
Yeah, they want you on the standard of care.
Oh, okay.
Yeah.
Well, thank you anyway. But young
No
lady,
problem.
if you are bleeding, please go see about the doctor, because I was bleeding and they wasn't treating me, and so it didn't turn out well. It didn't, I had a serious problem, so I suggested you, and please go and find other doctors, because if you're not satisfied, don't take it, and ask for a patient advocate. That's what I do. I ask for a patient advocate if I'm having a problem with doctors or whatever. I'm completely honest. So good to see you. Look very, very
Good to
well.
see you too, and thank you for reassuring the young lady who shared before you.
Yeah.
Yeah.
Have a blessed day.
You as well. All right, back to the slides. Let's wrap this thing on up. I can't believe how fast 90 minutes went.
You have one more.
Sharon. Oh, okay, go ahead.
Jacqueline.
Oh, I didn't know anybody. I'm sorry. No, I was the one who said something about the red yeast supplement. Red yeast.
Yes. Yeah.
My doctor actually, my endocrinologist actually prescribed that to me, even though it's over the counter. And he didn't tell me anything about the side effects, which is what I get concerned about, because a lot of doctors, they don't really look at that. And then at your other meds, they don't know how they're going to interact. So I have a really good relationship with my pharmacist, and I only use one pharmacy. And he will break it down to me and tell me how they interact with each other, if I shouldn't take them at the same time, all of that stuff. So I think it's important that we have that too.
Oh, absolutely. Your pharmacist is, participating in your healthcare. And sometimes patients get medicines from more than one doctor. Sometimes they forget to update their medication list with us. And so I may not know you're on this, obscure drug from your neurologist, and I prescribe something, and the two interact. The pharmacist will let you know, as well as the pharmacist will call me and say, hey, doc, did you know about this? Are you sure you want to prescribe that medicine? It's nice to go to a mom and pop's pharmacy, because they give you more personalized care and attention. When you go to these big on the corner pharmacies, watch how the pharmacist or pharmacist tech handles that machine when they're checking you out. That machine that you put your copayment card into, or your debit card to take care of your copayment for your drugs, or to complete that transaction, it asks you, do you have questions for your pharmacist? Do you want to talk to the pharmacist about that? And oftentimes the person will reach over the counter and select no for you. So it appears that you made a decision to not talk about your medicine when you didn't actually do that. So stop them from checking things off for you. See what that screen says, and take the opportunity to inquire about if there's drug-drug interactions or any side effects that you should know about these medicines. Don't allow them to opt you out of receiving information that is valuable to your health and well-being. Thank you for bringing that up. That's so important.
Thank you.
So important. Next slide, please.
Dr. Alexea, before we go to the next slide, we had a hand, I'm speaking to the community, we had a hand raised earlier from Evelyn. Evelyn,
Okay.
did you have a question? Was your question answered? Are you okay with us moving forward without you?
I'm sorry, Evelyn. We don't want to leave you behind.
Yeah, she had a hand raised, but she took it down earlier, but it's
Okay.
in my mind, so I just want to ask the question before we close up.
Thank you so much.
Evelyn?
Is she still in the space with us?
Yeah, she's still in the space.
Oh, okay. Yeah, see.
He might be at work.
I'm going to take that as a no, that you are complete with us, and I'll move forward to the next slide.
All right, awesome. So thank you always. Thank you for you all's time and attention, and for showing up in the space with me, for sharing yourselves, your story, your health history so freely with us, because it gives everybody an opportunity to learn from your share. So I appreciate that so much. Next slide, please. So definitely please do check out my supplements, and please email me. So last time I was on here, I left for vacation the following day and I drowned my cell phone in a I don't know, some body of water in Mexico. And so I was without a cell phone, which is unheard of for me, for a whole week. So if anybody in this space feels slighted that I did not follow up with you, I do sincerely apologize. So if you were the recipient of the previous special order and special offer, like the gift, and you're in this space, please do email me again. I get, I'm sorry, hundreds of emails a day. But in the day that I know I'm receiving them and looking for them, they're easy to find. But a week without a cell phone, when I was last in the space with you all presenting and sharing, I lost track of my people. So I sincerely apologize for that. So check out my website. Oh my God, look at Cheryl's like, yes, I was one of the recipients. Please text message me, Cheryl. I know you have my cell phone. So check out dralexea.com/supplements and email me, please. Next slide. And I promise I will not be near any bodies of water, so I can't drown my phone. As was shared earlier and in the chat, you can find me at Dr. Alexea, DRALEXEA, on Facebook, Instagram, and Twitter. Next slide, please. And you all who show up so faithfully in this space, either on Zoom with us or via Facebook, or engaging with us in the community, remember you can make love offerings and donations through Zelle and QuickPay at soleadershipdevelopment@gmail.com, or you can Cash App $Spirit of a Woman. And for today, you can use code #720AG. Next slide, please. You can also do automated love offerings and donations. You can do them monthly. You can use bit.ly/woo, so WUE love, and you can do WUE love 25, 50, 75, or 100. As a monthly automated love offering to support this amazing space that has been holding us down for 720 whole days since we started in this pandeezy, because COVID's still COVIDing, y'all. And now we got flu and RSV, and we're coming into pneumonia season, and the asthmatics know they are under attack this time of the year. So please continue to support this space that has supported us all in this amazing community. Next slide, please. All right, so next up, Sunday, November 20th, 2022, our sister Cheryl Glenn is going to be doing self-care. Sleep is medicine. This is such an important topic, right? This is so important. Take your butt to bed. Sleep is so important. It's where our body restores, heals, and recovers. And we cannot undo sleep that we didn't take. So please, please, please tune in on Sunday. I know I plan to be there. Next slide. Of course, the Wake Up Everybody community welcomes new members. If you joined us in the last day, if it's your first time here in the last week, welcome, welcome, welcome. We welcome you to our community, and we invite you to share our community with your friends, your family, your loved ones. Send them the link, tell them to come visit us on Facebook. And then the Wake Up Everybody schedule, you know, we have our Zoom live workshops Sunday, Tuesday, and Thursday, 7 to 8:30, Monday and Wednesday, 7 to 7:30. You can watch with us here on Zoom, or you can connect with us on Facebook. You can text Woo Nation, WUE Nation, to 74121 to stay connected with us and get text alerts. And that's amazing. I live for a text alert because I don't remember anything. Next slide, please. And don't forget your Woo swag. I love me some swag. I have a million tote bags because I like to represent my people. I'm all about a good coffee mug. We need to stay hydrated. So get your water bottle, get your notebook, your journal, right? We get such gems in this space. Have a place to write it down and refer back to, or just a space to journal and express your gratitude, to write down the life you want to manifest. Wear your mask, get warm, it's hoodie season, it's sweater weather. So check out the Woo Swag. So bit.ly/Woo Swag online. And don't forget to stay in touch with the Wake Up Everybody community. You can register for our live events, bit.ly/Wake Up Movement. You can join the Wake Up community, bit.ly Woo Community. There's a private community as well as a public space. On Instagram, it's Wake Up Everybody Virtual, and on YouTube, it's Woo on YouTube. And then email info.wakeupseries@gmail.com. Make sure you stay in touch with us. This is an amazing community, and there's so much to give and receive in this space. Next slide.
I like to do this slide.
You go right ahead. You go right ahead.
At Woo, we're offering you the opportunity to join our volunteer team. You can put your talents and abilities to good use, where you can serve and support each other and yourself. Because just being here, the admin, you get so much value out of the information that's shared every day, 5 days a week. You can join our team by sending an email to info.wakeupseries@gmail.com, and one of our volunteer members will reach out and contact with you. There's a lot of value in being an admin. I myself joined this team 2 years ago, and I want to tell you I've grown so much from the opportunities of being an admin here. And there's so much to do and so much to give. And this is a great place to do your volunteer work. I recognize that being a volunteer is you put yourself in a mode of receiving. We ask, and acts can come easy, but how do you get into the mode of receiving? Volunteer. Gratitude and volunteering are some of the great aspects and great resources to put yourself in a mode to receive. So I invite you to be a volunteer on Woo. Thank you so much, everyone. And now I invite you to share your love and appreciation for the session this morning from Dr. Alexea, with all the value that she's offered us. And we will grow because of this value. I invite you to come off mute, share your voices, share your faces with us this morning, and bless Dr. Alexea with love.
Woohoo! Thank you,
for
Dr.
that.
Alexea.
Thank you. Awareness.
Always
Thank you so much.
For the thanks.
Always inspirational.
And you look
Yes.
beautiful.
Educational. Thank you.
Thank you for the great presentation,
Thank you so
Dr.
much.
Alexea.
You are
Blessed
so
doctor.
Know
appreciated.
your body.
Thank you.
Bless you for everybody, and have a blessed weekend.
Thank you, beautiful doctor. Thank you, beautiful
Aw.
Woo family.
Totally
Y'all are so
appreciate your
awesome.
time.
your
Mwah.
expertise.
Thank
Thank
And
you.
y'all
Love
keep us up
y'all.
in the
you.
Love
morning.
y'all.
Look,
Love y'all.
Adam,
Thank
Love
I'm
you,
y'all.
giving
Love
you
doctor.
y'all.
kisses. Thank
We
you. I
need
see
this.
them.
Love
As
y'all.
always,
Back again.
What?
as always, love.
Your
Love
Thank
patience and
y'all.
your
Love
love.
you.
y'all. Love y'all. Love y'all.
And
Thank
be
you
on
for
the
Love
looking
lookout for
out
y'all.
for the
Self Care
community.
Saturdays on
Love y'all,
Facebook on
admin
the Wake Up
team.
So,
Everybody page.
so
John
grateful.
Cole Martin and Mr. Coach Cheryl. I go say Mr. Cheryl.
Blessing.
Love
Thank
y'all.
you. Thank you.
Have a wonderful weekend.
Thank you.
Thank you,
Be
thank
Thank
you,
so
you,
thank
good
you.
to yourself.
everyone.
Thank you,
Love
Dr.
y'all.
Alexia, for all that
Bye, everyone.
invaluable
Thank
Thank
you.
y'all
information.
so much.
Peace
Have a
and
great day,
blessings
everyone.
from
Have
one
a
Awesome
good
weekend.
healthcare
one.
person to the next.
Give your
I know.